I think the most memorable events in cardiology really occurred in the 1950s with the development of cardiac surgery. I think that's what we've been known for through the years. There were several events and procedures that were done. Probably the most noteworthy were the early operations by Dr. Lillehei. The first open heart operation was done by Dr. Lillehei in March 1954. And it's interesting that about 14 months later after his operation, they began doing similar operations at the Mayo Clinic. The first operations were done with a parent as the heart-lung machine, essentially. There were two operating room tables. The child was on one table, and the parent was on the other table. And the blood from the parent was sent into the child and perfused, and then the blood from the child went back to the parent to be cleansed and filled with oxygen. So they did 45 of these operations over about a 16-month period. And then in 1952, a bright young guy by the name of John Lewis began the first of a series of 60 operations to close the holes between the upper chambers of the heart. And he did that without a heart-lung machine. Cooled the patient down to about 80 degrees. And, you know, when you lower somebody's body temperature, you don't need as much oxygen. So he was able to lower the oxygen demands and then went in and closed off the blood vessels that took blood into the heart, was able to open the right atrium, the upper chamber, go through there, close the hole between the two upper chambers, and come out all in 5 minutes. And so he did 60 of these, and the first patient is still living in southern Minnesota at age 65 and is doing very well. Hardy Minnesotans. After Lillehei's 45 patients, Dick DeWall, who was a surgical fellow here, developed what was called a bubble oxygenator. And he was working with Dr. Lillehei, and Lillehei said, I want you to build an oxygenator, but I don't want you to read anything in the literature about it, and I don't want a bubble oxygenator. Well, he developed a bubble oxygenator that was ready to go into action in 1955, and has really become the prototype of all current oxygenators for open heart surgery.